We're doing part 6 of sensory special senses, page 570, and we're into now just sort of wrapping up the pathway for the gustatory innervations. So they show us very specific pathways here, and let's take a look at that. We see that we have 3 nerves here. One nerve here is the vagus nerve, number 10, and that's heading in here. Who is that there? That's the solitary nucleus. We're entering the medulla from the tongue region. Then over here, that's number 10. Number 10 also, it should be noted, comes from the roof of the mouth or the palate. Number 9, right here, this one, number 9, glossopharyngeal, is coming from this posterior portion of the tongue, specializing in bitter and a few other things. And it's also going up there to the medulla. And then the anterior 2/3 of the tongue is going to be the facial nerve. And it's going to have the widest range of possibilities of sweet, sour, and salty possibilities here. Some people retain that foliate papillae type of thing over here later in life. I think females more than males do, because females are slower in their upper anatomy above the waistline to change their connective tissues. Males have a tendency to really develop their connective tissues above the waist. Okay, so at any rate, facial nerve going up. So these are the 3 nerves, cranial nerves involved in taste. We have 2 more cranial nerves, number 12, the glossopharyngeal, the hypoglossal nerve operates the muscle of the tongue. So the tongue, when it has to do with movement of various kinds. And then we have touch sensation. Okay, this actually is an important component of food for many people, because some people like things to be crunchy and other people like things to be soft, right? So everyone has their preferences, and sometimes they marry each other and then they have to adjust their recipes. So those are things to consider. At any rate, so we have these 5 major cranial nerves playing a role with the tongue. Okay, so number 5, touch, number 12, motor, numbers 7, 9, and 10 for taste. Okay, and that summarizes that. We're going to move to hearing now. It turns out that there's actually 2 mechanisms involved here. They're sort of like positioned together, and we're going to be seeing them over here. There's a portion of this for hearing, and there's a portion of this for balance in space. All right, so there's what's called static and dynamic equilibrium. So we'll consider that. That's way deep into this bony structure right there. But first we come out here. Here's our ears out here. And we have this helix out here, which is this curly portion of the ear that curls around. We have the auricle and the pinna of the pinna. This whole region out here is actually shaped to receive information. So when people are talking to us, it's as if we have our hands cupped over here. You can actually improve the hearing by cupping your hand over this portion of the ear and collecting more sound. The sound then reflects inward through here and vibrates the tympanic membrane. So that's the deal. What's missing in this picture is this little triangular fold of skin right here that's anterior to the opening, and you can press down on that triangular fold of skin and close the ear canal. That's the tragus, that little sort of elastic cartilage portion of skin. This whole thing is elastic cartilage, which means that it sort of recoils back into its normal position unless, of course, you're engaged in some sort of very rugged wrestling type of activity, in which case you might challenge the elasticity of the elastic cartilage. Be careful with that. So that's the outer ear. Here we have the external acoustic meatus, and that's a bony thing. When we have the skin over it, we call it the external ear canal. That ends right here with this unit called the tympanic membrane. And as you're looking in there, you might be an ear, nose, throat doc, or just a nurse checking out what's going on in there. And you look in with an otoscope, which shines a little bit of light in there. And what you'll notice is that there's this little wedge of light that reflects back. That's a good thing. That means that there's no swelling in here. If there was inflammation and swelling, it would push the tympanic membrane this way, and you wouldn't get that little arc of light. So it's nice when you can see the arc of light. That's an important detail. If we look down here at the bigger drawing, you can see that big arc of light. Notice embedded in the tympanic membrane is the something that's called the Malleus, or the hammer. The hammer, or Malleus, is going to be sort of tapping against this surface right here of something called the incus, or the anvil. And then over here, we have something called the stirrup, which is taking the vibration from the incus and then magnifying it up against the oval window. There's an oval window right here. Does that say that? Yes, oval window. And there's going to be an opening in there that leads to this sort of snail shell type device over here called the cochlea. Okay, this is the middle ear. It's connected to the nasal cavity. And inside the nasal cavity is an opening for this passageway. There is no such word as this in any dictionary I've ever seen. They kind of made this up. I don't know why. It's commonly called the auditory tube, or eustachian tube. That's the proper name. And I think that they're trying to coin a phrase here. I don't know why that is, that they would take that opportunity, but they did. At any rate, we do have an internal acoustic meatus right here, a bony opening into which cranial nerve 7 and 8 will pass. Number 7 has little to do with the things we're talking about here. Number 7 is actually going to break away at some point here and sort of like curve down and exit down through the temporal bone at the stylomastoid foramen and come around the front of the ear and take care of muscles of facial expression, okay, along with tears and saliva. So we won't be concerned so much with facial. We'll be concerned with number 8, vestibulocochlear. Okay, so the vestibular part is over here. This is the vestibular nerve. Okay, vestibular. The cochlear nerve is here. Collectively, cranial nerve number 8 is vestibulocochlear. Okay, so over here, the vestibular nerve is going to go and innervate all of those little sensory transformation devices having to do with in what position is my body. Right, some of it's dynamic and some of it is static types of equilibrium or balance. Over here, we're going to have sound. Okay, so that's our mission. If there is an infection here, and something that I want to bring to your attention that I learned about when I was raising my son, because I had just attended medical school, and my son's mom was a nurse midwife, and we both knew pediatricians very well, and we knew that pediatricians have children that don't have otitis media. They don't have infections that travel into their middle ear and cause problems here with the tympanic membrane. And we found out why they don't have that going on with their children, is they don't allow their children to blow their nose. It turns out under the age of 5, this portion, this part of the facial anatomy and skull anatomy is very straight, wide, and short. And so that means that if you were to try to blow your nose as a 3-year-old, you might actually force the mucus up into the middle ear and have an otitis media infection, a middle ear infection. And I taught my son instead to just do raspberries, make funny little sounds like that. He was very satisfied with that because he liked sounds, and he didn't seem to miss blowing his nose at all. And so he never had otitis media, thank goodness. Okay, we'll travel into that territory again at some point. Here we have this overview, which we'll pick up in our next little episode of Special Senses.